The video you're about to watch is an end-of-term review. One of the more challenging tasks for supervisors is giving constructive feedback about performance when it is below the required standard. This video is about one of these tricky interviews. Have a look and see how the supervisor is interacting with the trainee. Imagine you're watching the interaction and you've been asked to be a third-party observer and report back.
So, Lauren, there is one thing that we particularly need to talk about today. As you know, we need to consider all the attributes in the end-of-term assessment. Your clinical acumen is very good, and you've had a very good surgical record, but we've spoken before about your communication skills.
Yes, I'm so glad my feedback has been good. I've been working so hard on my exams. It feels like I have information coming out of my ears. Go on, ask me any question. Oh, I'm kidding. Once I've passed my exams, then I can focus on being nice to people, right?
Well, I wouldn't say that was the right attitude, Lauren. I mean, good communication is a very important part of looking after patients. So I've always found...
I know that. God, of course. I didn't mean it.
So we've spoken before about a number of things in relation to your patient and collegiate communication. Now you're very confident and clear, but sometimes you talk over patients and other staff members, not giving them the time to ask questions and perhaps not considering their needs.
Well, that's usually because I'm actually doing what's best for them and getting through as many as possible. You know the crazy number of patients they tried to squeeze into a clinic, right?
What does good communication mean to you?
Really? There are lots of things that make up good communication. You seriously want me to name all of them? That would take all day.
Yes, please, if you don't mind.
There's the different elements. Clear introduction and conclusion, effective information gathering and explanation, including clarification and non-verbal skills, planning with the patient's illness framework in mind, appropriate structure and control of the interview.
Right. That's correct. Calgary, Cambridge, yeah?
Indeed. I know it's far more complex than that, but that model has like 70 different bits or something, so it's pretty thorough. At least that's what they told us in med school.
Yeah. There was one section that you forgot to mention. Building relationships.
Oh.
Rapport, empathy.
Yeah, right, of course. But that's a given, isn't it? And really, it kind of comes naturally. I mean, you can either talk and be friendly or you can't, right? That's really for the socially inept.
Well, actually, to be honest, Lauren, I think you might be missing the point. You see, relationships in medicine are not a popularity contest. They're about creating trust and confidence and building the kind of relationships that encourage compliance in your patients so you get the best patient outcomes.
Like I said, I know how to communicate. And as far as I know, my patient outcomes have been fine. No complications on my watch.
I'm not questioning your skills per se, Lauren. It's just that I'm not entirely sure that you fully understand how important your relationships with your patients are. Now, we spoke about this at your midterm meeting, and you went off to the communications workshop and you spent some time with Dr. Roberts. Did you feel that helped at all?
Well, it's hard to find time to think about it much, or to practice any of the skills you're talking about. I guess if I was the boss looking after the patients myself over the long term, I would be able to spend time on it. But you know how the term works. It's so busy and all about just getting through the patient load. And we're always moving through, looking after the emergency clinics. So I'm not seeing the same people anyway. And it doesn't really feel like the college thinks it's a priority in my experience. And the pressure of exam prep and the amount we need to know is so overwhelming. I am, perhaps, putting things further down the priority list so I can pass, And then, once I'm actually a consultant myself, I'll be able to focus on that stuff. You remember what it was like.
Clearly the consultant here is not happy with the trainee's response. He is trying to address a number of specific problems. Useful questions to ask might be, can you identify 2 of these problem behaviours that the trainee demonstrated during this interview? Do you think it would help to draw the trainee's attention to these behaviours as they occur? So who mostly controlled this interaction? And in general, what plans or strategies could you use to help this trainee?